Hi, everybody. I'm Therese Laub, and welcome to A Cup of Comfort with me. I hope that you have a cup of your favorite beverage to enjoy while you listen today, because this is all about you, the care hero. So today is one of those nuts and bolts topics that's incredibly important: wound care. You might be thinking, what wounds? And wondering what I even mean by wound care. Well, there are obvious wounds, such as accidental cuts and incisions post-surgery, and sometimes broken limbs that come through the skin. But do you know what some of the other kinds of wounds are? I had never even thought about it before I became a care hero for my parents. Now that you are a care hero, have you heard of bed sores? Those are pressure wounds that require healing. Has anyone you know had to work with an ostomy? If you don't know what an ostomy is, think of it as an opening into your body. And again, an ostomy requires wound care. And there are many more examples and much more to know. While providing care for my parents, I ran into several situations that potentially involved wounds and the need for assistance with a wound from a wound nurse. I wrote about the issues we encountered and how we dealt with them in my book, Through the Rabbit Hole: Navigating the Maze of Providing Care. First, pressure wounds from remaining stationary, either in bed or upright too long, can result in what we commonly refer to as bed sores. Medical care dictates that the patient be turned or moved every 2 hours to avoid pressure wounds. That might involve shifting the weight distribution while in bed or moving them between the bed and a chair. Many hospital beds have air mattresses that actually move in order to slowly and somewhat gently redistribute the patient's weight. We were successful at avoiding bed sores by moving each parent at least every 2 hours when they were stationary. When my mom was in the hospital and couldn't tolerate the moving mattress anymore, an egg crate mattress worked equally well. While at the medical facility or under in-home health care, pressure wounds are tended to by wound nurses. Secondly, my mom needed a colostomy due to a blockage in her colon, and we didn't know anything about the necessary care. To be clear, an ostomy is not a wound, but it falls under the wound care nurse's expertise. In fact, the objective of ostomy care is to prevent a wound. The wound nurse at the hospital trained my sisters and me, but we were overwhelmed and unskilled, very unskilled at first. The unit nurses really didn't know how to work with the ostomy. Once mom was home, in-home health was supposed to assist us, but they knew a little more than we did about the options for supplies and the care necessary. When in-home health was no longer helping us, we were virtually left on our own. It took us a long time to understand the terminology, the product options, and the process for using and acquiring them. We made a million mistakes. We learned almost everything through trial and error. That was anything but optimal, as an accessible wound nurse is critical to success with ostomy care. Thirdly, post-surgery, my mom developed something called a deep wound. It was like a cylinder or a roll of nickels down from her belly down into her body. And at home, the wound had to be cleaned and packed with medicine and gauze frequently, as well as measured for healing process or to determine the progress. Again, clearly a wound nurse needed to be involved. And finally, I had a personal experience with something I would not normally have thought of as a wound. I recently had a big toenail removed. The doctor described it as a simple procedure, which it was. And she went on to say it was a short and easy recovery, which it was neither. Unable to get hold of the doctor for assistance. And about 3 weeks passed when I was told my wound would have healed. In desperation, I contacted my guest. She looked at photos and told me exactly what to do. Immediately after following her advice, my toe began to take huge steps towards healing more quickly. Yes, it is invaluable to have access to a wound nurse. Now, before I introduce my guest, I want to remind everyone that some of the information from today's show will be available in a downloadable PDF on the Care Hero radio page of my website, and that's Trish, Trish, Laub, Laub as in boy.com after the show. Now, Therese Laub is a board-certified wound care nurse, helping people with all types of skin problems and chronic open wounds. She started her passion for wound care about 20 years ago and has worked in home health, hospital, and long-term care settings. Her knowledge has helped her develop educational programs and literature to teach doctors, nurses, patients, and yes, care heroes, how to assess and treat all types of wounds. She is currently working with a molecular lab doing PCR testing for wound infection and is always seeking ways to bring better technology and understanding to this industry. So welcome, Therese. It's so good to see you, if only virtually.
Yes, right. Nice to see you, Trish. Thank you for having me.
Well, thank you for coming on. This is such an important topic, and it is such a challenge for care heroes when they really don't have any experience or expertise in it. So let's get going. So wound care nurses, what are they? What do they do? And how do you find one?
Okay, well, wound care nurses are specially trained, and we usually take classes and have to pass a test to become board certified. But really, most of the experiences in becoming a wound nurse is at the bedside and working with patients that have these skin issues. And I've been doing this, as you said, about 20 years, so I've seen quite a bit out there. And it is important, like you were saying, when you are faced with a situation, when either yourself or you're caring with somebody with a wound, to have somebody available to help you through that process.
Mm-hmm.
It can be very scary to have to look at that and see, especially if things start deteriorating and getting worse, to know what you can do and where you can go. There are ways in finding out wound care nurses in your area, no matter where you live. I always suggest talking with a primary care provider or somebody that you're working with, your doctor or nurse practitioner, because a lot of times they can refer somebody that they've worked with. But there are two websites. There's the Wound Ostomy Continence Nurse Society, and there's the American Board of Wound Management, and they both have search engines on their websites where you can go based on your where you live to see who would be available to you.
So I know that when my parents were in the hospital, there were wound nurses as part of their staff. But let's say somebody has gotten home and they no longer have home health and they run into a problem. Can they just go to those websites and independently hire a wound care nurse? Is that?
There is ways they could do that. Some of the people that are on those sites, though, they may be working at a clinic or they may be working for the hospital, but a lot of times they can refer you to somebody that would be doing it in the home. And a lot of home health agencies nowadays are focusing more on wound care programs. So a lot of times it's finding those agencies that have those specialties, to help, that will come to the home.
Okay.
So, yeah.
So talking about the process of the skin and why we get, especially our elder population has wounds. Can you talk about that a little bit?
Yes, yes. Yeah. As most people know, your skin is an organ. It's actually the largest organ in your body. So just like your kidneys or your lungs or your liver, there's chances that things can go wrong. And the older you get, the more there's, possibilities depending on diseases that you may have or situations you may be in, that you have these issues with your skin. And as all of us know, as we get older, our skin changes as well. There's a lot of changes that occur as we age that are based on just the aging process, but it could also occur from environmental factors too. I know I had a picture, I don't know if that's available to put up, but it's a hands that you could see a younger person's hands next to an elderly patient's hands, where you could see the thinning of the skin. You could see the blood vessels that are more surface. The collagen that we have in our skin tends to decrease over time, so the elasticity in our skin goes away. When that happens, we're more prone to having problems, even from things as minor as like bumping yourself on the arm, just things like that. Things like the sun, people that are exposed to the sun, especially when they're younger, they can have a lot of issues as they get older. And I know that that's been preached a million times, to wear sunscreen, but I've seen a lot of problems where, there's a lot of damage to the skin because of things like that. Nutrition and hydration, I cannot emphasize that enough, and how important that is, eating well and drinking. It seems that the older we get, especially in the elderly, we eat less, we drink less, and it's your skin is going to be the first thing that's going to react to that. So it is important to keep in mind. And as caregivers, when we're with the people that we're, taking care of, these are the things that they see, right? I mean, you're the ones helping them eat, or you're getting their drinks. You may notice they're not eating as much or drinking as much, but that should be a red flag that, their skin may react to that, you
So
know.
as a care hero taking care of somebody,
Mhm.
what kinds of things should they be looking out for? What might be the first things they would see that would indicate that there might be a problem brewing, a skin,
Right.
a wound related problem?
Right. Like I said, it's the thinning. And a lot of the first things that people notice are skin tears or bruising, right? So you bump your arm on something, and next thing you know, you got your skin that's coming off, right? So now you have a wound that's there. There's other conditions too, as we, get older, there's moisture problems. If, especially this time of year coming up in the summer, a lot of people are sweating and there may be incontinence issues. So people develop sometimes like rashes or fungal infections in the skin folds that need to be addressed. And sometimes it's hard to know, is that just a redness because it's been wet, or is it a fungal infection that's going to create a problem? And the way you tell is if you keep it dry and it still starts spreading, you may have a fungal problem, which needs an antifungal treatment to it. But those are pretty common, that I see. The other things that, can occur with skin breakdown is sometimes conditions that people have cause swelling or edema in the lower legs. And once you have that pressure from the inside on your legs, it creates the skin even thinner on the outside. And sometimes that fluid can ooze out, and then all of a sudden we have an open wound. And that can be very difficult to heal as well. People that have circulation issues to their lower legs, the blood is not getting the nutrients to the cells down there, so there could be breakdown. And again, you may just bump your leg on something, all of a sudden you got this sore and it's not healing, and it's like, oh my gosh, what do I do? But it could be because of underlying issues that it's not healing, which is what really wounds are all about. That's really what happens. People with diabetes, that's a big one, with their feet. A lot of people develop calluses on the bottom of their feet from ill-fitting shoes, because a lot of times the sensation in the bottom of the foot is not there, so they can't tell. And once a callus forms, there's actually a 90% chance that a wound will develop. So it's very important, to be checking the feet of anybody with diabetes daily in case there is a problem like that. And wound care nurses are great at that, but podiatrists are also, highly recommended when it comes to foot care. There's a lot that they can do with shoes and with offloading device and all this other kind of stuff to help people with those issues. But there's some things like high blood pressure too that can cause issues in your lower legs. There's a lot of things that contribute to wounds that could happen.
Wow, I hadn't, in the beginning of this, I mentioned the few things I considered wound experiences, and listening to you talk, I'm like, oh yeah, we had that. We had to deal with that. We had to deal with that. You
Yeah,
know, I guess you just
right.
don't, I just never thought about it, like skin tears and the water retention in the legs and things
Mhm.
like that. And I knew it was a big issue to try to deal with and treat, but I never really thought of it as a living wound per se. So
Right. And unfortunately, some people do experience that.
yeah,
It's really a shame how bad sometimes that can get. Um,
yeah.
but one of the biggest, challenges, is when somebody has cognitive issues, people with Alzheimer's or Parkinson's, and they're not aware of what they're doing or not doing. I had a patient once in home care that I went to later in the day. It was like 3, 4 o'clock. And the daughter told me that her mom had been sitting on the side of the bed for 8 hours because she didn't know to move. And these are the situations where skin problems occur, right, from pressure. You and I know, and most people know, when they're sitting and they adjust themselves, or they go to the side, right?
Mhm.
But if somebody is not aware and they sit in one place, you have bone on top of your or below your skin on a hard surface, and all of a sudden that tissue starts dying in between, and this is where pressure injuries, become a problem.
And is
um,
that kind of what you meant when you said, when you were referring to that red spot on somebody's hip?
yes,
And the
I'm
title
getting
is
right
just,
into that.
all right.
Right. So,
Yeah.
all right. So take, for instance, you and I are talking, or somebody's sitting with their legs crossed, and you notice this red mark on your elbow from like on the chair or the table, or you uncross your legs and you see a red spot, right?
Mhm.
How you know if that's a pressure related injury is where the red spot would be is you take your finger and you push down on it. When you release, the tissue should turn white and then come back to red. That's called blanching. Okay, that's a very natural, normal thing that happens when you have redness on your skin from a temporary pressure. Now,
So
let's
it
say,
should become white again.
yes, so you
Okay.
press it, you release, and you see a little white mark, and then it gets normal skin tone.
Yes.
Okay, so this is a test that somebody can do. So let's say you have a loved one that's been laying on their side, and on their hip they have this big red mark, right? So they push down, and when they release, if it remains red, that's a problem. It's the beginning of tissue death. Okay, so you immediately have to relieve all pressure from that area, or else it's going to continue to die. Okay, so pressure ulcers are staged. Stage 1, which is what I just explained, where it's just a redness on the skin, all the way to stage 4, where it could actually go way deep down to the bone. Okay, but keep in mind that pressure ulcers are over bony prominences. You know, your heel, your tailbone, your elbow, you know, those areas. So it's important, if you see redness, is to, you know, do that test to see if there's a problem. The other thing you can do is just relieve pressure from it. And if it doesn't go away in a half hour, you know, you got a problem. Okay. The other thing that can be a problem is what's called a deep tissue injury. I see a lot of these, unfortunately, as well. And what that means is that the tissue death has already started occurring underneath the skin, and it's presenting as a bruise over a bony area. Okay. They're very common on the heel. So people that lay for long periods of time, you know, people that maybe sleep on their side and their knees are together, and then you get this round area between the knees and it looks like a bruise. When you, or if you ever notice that, hopefully you don't, but if you ever do, that could be a very critical thing to have looked at, because once the bruising occurs, it's the death of the tissue underneath. And if that opens up, it could be a problem. So that should probably be watched very closely and possibly, you know, be looked at by a professional.
And, you know, I'm not suggesting in the next thing I say, I'm not suggesting anybody does this, but what we ended up doing, we had my dad's heels would start to get that redness. So we took just like a washcloth and put it up underneath his ankles to get his feet off of the bed. And then he'd say, well, the sheets are pulling his toes. So we put one of those rollers underneath to keep the sheet up. And then, like you say, the knees, we had a whole variety of pillows that we could put in different places. And one thing I want to be sure to talk about, because I think people, my experience is that people don't take bed sores seriously enough. And they are, you know, they hear, oh, we're supposed to roll them every 2 hours. And be perfectly honest, we stayed with my parents because when they were in medical facilities, they weren't being moved. But I want to clarify for people, I think when I first started, I thought, oh my gosh, I have to take a sheet and I have to roll them, you know, 45 degrees or something. And then somewhere along the line, somebody said to us, and you can correct it, no, you can just move them incrementally by putting another pillow or something in there. Is that accurate? Or
no, that's a good
strategy.
No, that's a really good point, because like you and I, you may just shift a little bit to get the weight off that one place. It's not a huge thing that you have to go all the way over. It's just getting that weight, that pressure weight off of that area where it's been for so long. So that's a really good point. And one of the easiest ways to do it really is to put a sheet, like even just a flat sheet that's folded, and put it under the torso part, right, from the shoulders to the butt. And that way 2 people can really lift or pull up, or just like you said, put a pillow underneath or a wedge, just to get enough pressure off where that skin is going to get those nutrients and everything back there, so it doesn't break down.
Well, the nice thing about putting what I unprofessionally refer to as a pull sheet or a pad is that we were able to pull that up and put that pillow underneath. And I don't know what your experience is, but mine is that pillows tend to retain heat. They're already in a bed. And so kind of putting that pillow underneath that pad or that sheet kind of kept that heat a little bit further away.
It's true.
As I'm listening to you, I'm thinking, boy, we were really lucky because we figured out a few things and avoided apparently more problems than we had. So that's a good thing.
No, that is good. And a lot of it's common sense, right? I mean, it's just seeing it. Well, you know,
maybe to you.
I guess I don't know. But the main thing you want to do with any situation where you think there's pressure or could be pressure is prevent it from happening at all. So like what you said, the turning, and there's a lot of things on the market that are covered by insurances and Medicare that are available for these things. Because treating a wound is very expensive, and it's much easier for Medicare or insurance to pay for a preventative measure than it is to pay for the actual trying to heal the wound. So there are, like you mentioned earlier, there's specialty mattresses. They're called low air loss mattresses that can help turn. There's overlay products. You mentioned an egg crate, but there's other gel foam kind of combinations that you can put on the bed right over a mattress that's already there. There's cushions you can put on chairs or wheelchairs to help with your bottom, right? Yeah, there's the wedges that you talked about, and just things, pillows even, right? You know, there are things out there to help support, you know, that prevention.
When you
But like
talk
I
about the
said,
chair pads too, we had a wheelchair, full size, heavy, clunky wheelchair, but we also have what is referred to as a transfer chair. And
right,
I recommend anybody who has a transfer chair, and they're fabulous because you can pick them up and throw them in the back of your car, but sit in it for a while. See how your
yeah,
bottom half of your body fits. So I
that's
would
right,
highly recommend getting a good quality pad to put in the bottom of that transfer chair,
right.
because it's that's not really comfortable.
No, they're not.
It's not
No,
very forgiving.
no,
You know, it has other benefits that it's portable, but
right.
so
No, I
Therese,
agree.
let's say that I'm taking care of somebody and I see the beginning of that, and I'm not able, through shifting the weight or, you know, putting my little rolled up cloth underneath the ankles to make that better. What do I do? Who do I call?
Well,
What do
like
I
I said
do?
earlier, the best thing would be to get a hold of your doctor, to get a hold of a physician, see if there's recommendations that they would have for somebody that could help. They a lot of times could even help direct to a DME or a durable medical equipment company that's able to provide some of these devices to help, you know, because the goal is to get that red spot cleared up before it turns into the next stage, which is a stage 2. Which is very superficial, but it's still now an opening of the skin, an in for infection, and something that could potentially turn worse. And once that happens, or if that ever happens, once the skin is open and there is a wound, I highly recommend getting somebody involved that's going to be able to know what kind of product to use,
Sure.
you know, and what's going to really be the most beneficial treatment for that, you know.
When I mentioned ostomies, you know, there's a variety of different ones. My mom's was a colostomy, and I will say that the majority of effort we put into that process was for us figuring out the layering of product to put on my mom's skin so that she would not develop wounds, because
Yes.
that's a mighty durable adhesive that's on someone's skin. And sometimes it takes the skin with it. So it was kind of like a fine art to try to learn all of that. And, you know, I guess I'm grateful in a way that we didn't have a good wound nurse, because we had to learn. And then it pointed out to me that other people need this information, and that there are those organizations that you mentioned can provide some help with that.
Right. And ostomies can get very difficult. There's usually always a surgery that's involved once you have the ostomy placed, right? And there
Yeah,
could be skin issues after the surgery that you have to look at too.
absolutely.
Yeah.
Absolutely. Well, Therese, I want to be sure I give you time to answer the question. Is there anything else that you want to be sure the audience knows?
Well, I think it's important to know that as hard as it is with wounds or skin problems, just keep in mind that there are people out there that are willing and ready to help with this, because it can be very overwhelming. I've dealt with a lot of problems. Unfortunately, I've been called in at the end of a problem, or the worst point of a problem. And if you have any questions or concerns about when would be a good time to call, that's the time to ask the question. And I know you're going to leave some information, I hope, with your guests, where they can contact me if they need more information or would like to have a discussion about a situation. I'm more than happy to help.
I wanted to mention that
Yeah.
Therese does some private consulting on wound care. And I don't know if that email address is showing up on the screen right now, but for those who are not watching the video, Therese, can you share your email address or how you want to be contacted?
Yeah, my email is good. It's the spelling of my first name. So it's Therese, then it's L like Larry, 1964 @gmail.com.
Awesome.
Yes.
Well, I want to thank you for joining us today. It's likely every care hero will need this information at some point in time. I've learned myself so much today, even having lived through it and realizing how much wound care we were actually doing, or wound prevention, and not really realizing what a priority that was. As Therese mentioned, there's a downloadable PDF from today's show on the Care Hero radio page of trishlaub.com. And it includes information from today's show, as well as some additional information that Therese put together for the audience. So I want to thank you again, and I'll be talking to you soon, Therese.
Absolutely. Thank you so much for having me.
Oh, it's a pleasure. I want to thank the listeners for tuning in today and sharing this time with me. I'd really, really like to hear from you. Please reach out with questions, comments, topics you want to hear about, and share your story with me. Please go to the Care Hero radio page of my website, trishlaub.com. Fill out the contact form and let me know what you're interested in hearing, and let me know where you're listening from as well. I would love to know that. While you're there, download the PDF from today's show, as well as the previous shows, and sign up for my newsletter. Please join me the second and fourth Tuesdays of the month at 12 Pacific and 3 Eastern. Next time on March 23rd, I'll meet you here to talk about fostering wellness through experiential therapeutic tools with Ashley Swanson. That's a mouthful. This episode is near and dear to my heart, as I found relief for my dad with several of the things that Ashley will be talking about. I also want to take a minute just to share a few of the upcoming topics. In April, I'm going to be talking about the power of words and how word choice can impact the Care Hero experience. Felicity Warner, who is the founder of Soul Midwives program in England, will be here sharing her approach to a dignified end of life. And there is much, much more. I just want to say thank you to all the care heroes out there. I mean, we have just come across a 1-year marker of a process that started in 2020 that has made providing care exponentially more difficult. And while I already refer to each and every one of you as a care hero, all of you who have been providing care during this last year get a special designation of super care heroes. So until next time, remember that you are all care heroes, and many of you are super care heroes too. I'll meet you here next time. Thank you for listening to A Cup of Comfort with me, Therese Laub, and for your care hero courage. Tune in next time on Transformation Talk Radio as we explore life-changing care hero topics to assist you on your journey. In the meantime, I would love to hear any tips or insights that you've taken away with you today. So head on over to trishlaub.com. That's Trish Laub, Laub as in boy.com, and leave a comment, a question you would like answered, or a topic you'd like to hear about in the future. And while you're there, be sure to subscribe to my newsletter. So raise a cup and let's toast to all the amazing care heroes out there giving it their all. Until next time, remember that you are true heroes.